taking your calls today for Dr. Zorba Paster.
The number to call, 270-9933. Zorba joining us from his clinic in Oregon. Hi, Zorba.
Hi, Zorba.
Hi, good to see you guys.
As we wait for some calls to clear, you have a study about drinking Diet Coke every day increases the risk of dying young?
Right, increases your risk of dying young. Well, first of all, let's look at the history of diet soda. When you look at the history, it used to be made with saccharin, which we knew caused cancer, so that sort of bit the dust. It was made with something called cyclamates years ago. Then animal studies showed it bit the dust. But now, of course, it's used for generally recognized as safe substances, things like NutraSweet and sucralose. But the real question is, how healthy is this? And the study of the Nurses' Health Study showed it really may not be even healthy to drink. So the Nurses' Health Study is a huge study. They looked at women 50 years of age to 70 years of age who were healthy at the beginning of the study, who generally drank 1 to 2 sodas a day, diet sodas a day. And then they looked back at the data, and lo and behold, the women who were drinking 1 or 2 diet sodas a day had a 30% increased risk of stroke, a 30% increased risk of a heart attack, and had about a 5 to 10% increased risk of dying from any cause. Now, there's another issue involved here. People who drink diet soda generally are sort of out of shape. But when they controlled for smoking, when they controlled for diabetes, when they controlled for previous history of heart disease and so on, they still find that this sort of made sense. In other words, it still looked like that was the case. So I think the other question is, why are we drinking diet soda in the first place? Since we started drinking diet soda as a society, we've kind of gotten bigger and bigger and bigger. I think the ultimate answer is water. Sparkling water, plain water. Any kind of a soda with sugar is going to make you overweight. And diet soda, according to this study, may indeed have some serious side effects.
All right. Word of warning. Let's get to the calls. We'll start with Grant in Madison. Hi, Grant.
Hi, good afternoon.
Hi, what's your question?
My question is there any risk in ordering prescriptions from Canadian pharmacies, and what should you use for precautions? And do you have to watch out because sometimes they get their product from overseas, from Europe?
Well, first of all, we get a lot of our products from overseas, too. A lot of generics are actually manufactured in Israel and are actually manufactured in India. So even though you may get a generic and it's got an American name on it, it may not be manufactured here. So the problem with ordering from Canada, and I do recommend that some patients order from Canada, is you've got to make sure you order from a reputable pharmacy. Now, what's a reputable pharmacy? Well, that's exactly where it comes in. Who's going to say that it's reputable enough? But there are a lot of people who order from Canada, and they do just fine. I think it's the pharmacy. It's not where it's manufactured, but it's the pharmacy itself. And I can't tell you exactly which pharmacy I recommend, because then I'm going to actually say that I assure that it's fine. I know I have a number of patients who order from GoodRx.com. They look on GoodRx.com, which is an American website, and then they find a pharmacy on that, but not an easy thing to answer.
Okay, that's a reference point.
Yeah. All right, let's go to Rod in Plymouth. Hi, Rod. What's your question?
How do I increase my penis size?
Oh.
Oh, you know something? The website will tell you 10,000 places to look at to increase your penis size. The reality, it's like increasing your nose, increasing your finger, or increasing your foot. There is actually no known way to increase your penis size. So if you're looking for an erect penis, which is generally what men are talking about when they want to increase their penis size, the answer is there actually is nothing on the market. So save your money. Now, if you're looking to actually, for an erection point of view, Viagra, Levitra, and Cialis are the drugs to go for. And then there are ways that you can do things with your urologist, which actually use a suction, which will actually use the maximal amount to actually increase your penis. But unfortunately, or fortunately, it's just what you're born with.
All right. How did we end up here? That's the question.
We always end up here. Let me tell you something. That is not an uncommon question in my office.
All right, let's go to Lori in Mount Horeb. Hi, Lori.
Hi.
Hi, what's your question?
Yeah, I'm watching Zorba, and he was just mentioning that diet pop is not good, and for diabetics, you should just be drinking water. What kind of juice or something?
Well, What I said was actually wasn't for diabetics. This particular study that was published in the American Journal of the American Heart Association showed it might not be good for anybody. That's what the study showed. It wasn't just diabetics. So, and if a diabetic starts to drink any kind of a drink with sugar, then you've got to look at that as a carbohydrate and take that into consideration. So my recommendation to people is water. That's my recommendation. Water is the safest thing to drink. Artificial soda is artificial soda is artificial soda.
All right. We are out of time. Thank you, Zorba, for putting up with us. Thank you for going.
Thank you for rolling with things, Zorba.
All right, we'll see you next time. And